Hello, my name is Andrew Cornforth, Cancer Stem Cell Program Manager of California Stem Cell. I'm here to tell you about a novel approach to the treatment of cancer. As you will see, our therapy involves the use of cancer stem cells to load dendritic cells in the treatment of metastatic disease. In several FDA-approved clinical trials conducted by our laboratory, we have seen improved overall survival in patients with metastatic disease in the absence of any severe toxicities. It is our belief that the use of patient-derived tumor products, specifically in the form of cancer stem cells, may be the most beneficial pathway to the treatment of disease. The immune system can control cancer. This has been well documented for some years now. This was first observed by William B. Coley, a New York physician in the early 20th century, who observed that patients who had a recent bacterial infection spontaneously regressed their cancers. Another important aspect of the immune system in regulating cancer is organ transplant patients. It was observed that patients under immunosuppression had a 100 times more likelihood of developing cancer than people with normal immune systems. This is an indication that the immune system plays a profound role in the development of cancer and the spread of disease. Recently, two exciting new developments in immunotherapy have occurred. The FDA approval of Provenge for the treatment of metastatic prostate cancer and an antibody-mediated therapy called ipilimumab, which targets the regulatory immune system. To make a long story short, the immune system controls cancer in a manner that requires an effective stimulation. To be able to do this, dendritic cells are commonly used in clinical trials loaded with specific antigens that are known to be expressed on those tumor cells. However, in most clinical trials, the antigen of choice is not usually expressed on the cells in the patient, and therefore the effectiveness of this strategy is limited. And our belief is that the patient-derived products are the best products to use in cancer immunotherapy. More importantly, those products need to be derived from the cells that can lead to new metastatic disease. In order to be effective, cancer therapy needs to target the cells that can give rise to new disease. Cancer stem cell theory postulates that these cells can not only give rise to new disease, but have the ability to migrate throughout the body to new sites. Our process in the laboratory is to take those tumor samples, select those cells that are most aggressive, and then cultivate them, expand them, and then reintroduce them back into the patient in the form of dendritic cells loaded with these antigens. The process begins by acquiring a surgical specimen after a patient has surgery, sent to our laboratory, where the tumor stem cells are isolated, cultivated, and expanded. Once the process is complete, the patient then undergoes apheresis for the collection of monocytes to be able to be converted into dendritic cells. All of this takes place in the laboratory under strict sterile conditions. Once the cells are combined, the cells can be frozen, packaged, and shipped back to the clinic for treatment of those patients. The results in our clinical trials have demonstrated a 5-year, 50% response rate in patients with metastatic melanoma. By comparison, the 5-year response rate for these patients is normally only 10%. Many of our responding patients have remained disease-free for an extended period of time. As an example, this patient, a 43-year-old female who presented with central nervous disease and who had repeated systemic therapy and recurrences, responded to our therapy with complete remission. In addition to growing melanoma, our laboratory has experience in growing lung, renal, ovarian, and glioblastoma cell lines in a manner that's very similar to the melanoma cell cultures, in that we see tumor stem cell populations being proliferated. This gives us the opportunity to be able to treat patients with these disease types as well. Our theory for the effectiveness of this therapy is that we are cultivating the very cells that are the most aggressive form of that patient's tumor. Many patients report that their cancer spreads like wildfire. The cells that are responsible for that spread are the very cells that we're cultivating and isolating for use in our immunotherapy product. So in a sense, we're fighting fire with fire. Thank you for listening.